Hello and welcome you all. This is Nasir Ali here. Dear students, how are you? Hope you will fine. Dear student, in our previous lecture, we will discuss about the classification of the antifungal drugs. But in our previous lecture, we will discuss just about the classification, that how we can classify antifungal drugs into different classes. But in our today lecture, we will discuss one drugs from each classes in a detail. So without wasting any time, let's proceed our today lecture from the word drug acting on the cell membrane, and the subclass of is allylamine. And allylamine we will discuss about the terbinafine and niftyphene. So in today's lecture, we will discuss terbinafine in a detail. So let's start. So what is terbinafine? Terbinafine are belong to the allylamine antifungal drug, as we already discussed in the classification of the antifungal drugs. Drug acting on cell membrane in the first subclass of this class is allylamine. So terbinafine are belong to the allylamine antifungal drug and inhibitor of the squalene epoxidase enzyme, which is responsible for the ergosterol synthesis. And this terbinafine is the inhibitor of what? Is the inhibitor of the squalene epoxidase enzyme. And this squalene epoxidase enzyme is responsible for the synthesis of ergosterol. So this terbinafine inhibit the squalene epoxidase enzyme and ultimately leading to the inhibition of the ergosterol synthesis, and active both orally and topically. And terbinafine is active both orally and topically. It means that we can administer, we can use terbinafine both actively, both orally and topically. And the next one is fungicidal in nature. So terbinafine are fungicidal in nature. One is fungistatic, which inhibit, which stop the growth of fungi, and one is fungicidal, which destroy, which completely kill fungi, so known as fungicidal. So terbinafine are fungicidal in nature. So this is the general introduction of the terbinafine. Now move forward toward the mechanism of action of the terbinafine. So terbinafine is the non-competitive inhibitor of the squalene epoxidase enzyme, which is responsible for the synthesis of the squalene epoxide. And then this squalene epoxide is converted to the lenesterol and then ergosterol, which gave structural integrity to the fungus cell or to the fungus cell membrane. So terbinafine is actually the inhibitor. It is the inhibitor of the squalene epoxidase enzyme, and this squalene epoxidase enzyme is responsible for the squalene epoxide. This squalene epoxide then converted to the lenesterol, and lenesterol then converted to the ergosterol. This ergosterol and then embedded in the fungal cell membrane and gave structural integrity to the fungus cell. Let's study this with the diagram. So let's consider this is the squalene. This squalene is then converted to the squalene epoxide by the enzyme squalene epoxidase. So terbinafine bind to this squalene epoxidase enzyme and inhibit the synthesis of the squalene epoxide. So when there is no formation of squalene epoxide, then is no formation of lenesterol, and there is no formation of the ergosterol, and leading to the weakening of the cell membrane of the cell, or leading to the weakening of the structural integrity of the cell, and finally leading to the fungal cell death. So this is the mechanism of action of the terbinafine. Now move forward toward the resistance and pharmacokinetics of the terbinafine. So resistant to terbinafine, that how resistant are developed to terbinafine. So resistant are developed to terbinafine by two mechanisms, by two processes. The first one is the low permeability of the drugs. when the permeability of the drug decreases, leading to the resistance to the terbinafine. Or in the simple word, we can say that when the permeability of the terbinafine decrease, when the transportation of the terbinafine into the fungus cell is decreased, so ultimately leading to the resistance to the terbinafine. The second mechanism is mutation in the serine epoxidase enzyme. The terbinafine are actually bound to the serine epoxidase enzyme. So when there is mutation, there is changes in the serine epoxidase enzyme, so leading to the resistance to the terbinafine. This is the resistant mechanism of the terbinafine. Pharmacokinetics. Terbinafine administered orally and or topically. Terbinafine, we can administer terbinafine orally and topically. The bioavailability of the after oral administration is 40% due to the first pass effect or first pass metabolism. When we administer terbinafine orally, so the bioavailability of terbinafine is 40%. And why this bioavailability is decreased to 40% due to the first pass metabolism and due to the first pass effect, and highly protein bound drug and deposit in the skin, nail and adipose tissue. Terbinafine is highly plasma protein bound drug and it is deposit in the skin, nail and adipose tissue. So because of this, terbinafine is used for skin infection, nail infection and adipose tissue infection, and metabolized by liver and excreted in urine. Terbinafine is metabolized by liver and excreted in urine. So this is the resistant mechanism of the terbinafine and pharmacokinetics of the terbinafine. Now move forward toward the ADR of the terbinafine. So adverse drug reaction of terbinafine. Terbinafine may produce gastric upset, headache, hepatic dysfunction, rashes and taste dysfunction. So this is the side effects of the terbinafine. The contra-indication of the terbinafine. So what's mean by contra-indication? Contra-indication is the condition in which the administration of the terbinafine is prohibited. So this condition is known as contra-indication. So what is the condition in which we can't administer the terbinafine? So terbinafine can't administer in the renal dysfunction, the patient which is suffering from the kidney impairment, or the patient which is suffering from the hypersensitivity. So such a condition we can't administer the terbinafine. So this is the ADR and contra-indication of the terbinafine. The next one is uses of the terbinafine. So terbinafine is used orally for the treatment of tinea cupitis, a dose up to 50 mg OD. Terbinafine can be used for tinea cupitis. Tinea cupitis is usually the fungal infection of the skull characterized by the bald patches. So in this condition we can administer the terbinafine orally, and a dose up to 50 mg OD, means once in a day. And also used for nail infection and for cutaneous infection, a cutaneous layer of the skin, or the cutaneous infection caused by the dermatophytes. So it's also used for cutaneous infection which is caused by the dermatophytes fungi. And if you are talking about the dose of the terbinafine, so dose of terbinafine is oral dose 250 mg OD. We can use terbinafine as a dose up to 50 mg OD, means once in a day. If you are talking about the brand of the terbinafine, so terbinafine are available in the market by a name of Tersil cream 1% weight by weight cream, a product of the Pharmaceutical Limited, and 125 mg tablet by a name of Terbizol, a product of the Brian Pharmaceutical Private Limited, and Otic cream or Kiotic tablet, product of the Shrok Pharmaceutical Private Limited. So that's all about the terbinafine, general introduction, mechanism of action, resistance, pharmacokinetics, ADR, contra-indication, uses, dose and brand of the terbinafine. So I hope you people will enjoy the lecture. Otherwise, if you people have any questions regarding today's lecture, so you can ask me in the comment section. So thank you so much for giving me your useful time. See you in the next lecture. Thank you.